Dr. Noelle Lee. I am a DO, family medicine physician, and I highly recommend, if you haven't seen my Breathe, Walk, Bounce video on self-treatment for your own lymphatic system to increase your immunity, I highly recommend you check that one out first. But this one is on rib raising, which is a very simple osteopathic technique that you can use on a family member who maybe is having a little bit of respiratory symptoms. When we do this as osteopaths, it's a little bit more extensive and in-depth, but this very simplified version is something that is safe and easy for you to do at home. So this is Andrali Horn, my husband, who is going to be my osteopathic patient today. Thank you. So for starters, I just want to show you the part of the body that we'll be working on, because when we're actually treating, he'll be laying on the table face up and you won't be able to see where my fingers are. So turn around, please. Okay, so the rib cage covers your entire thoracic spine, which is your middle spine, from T1 through 12, which is approximately here. Now, the part of the ribs and the thoracic spine where the nervous system, the sympathetic nervous system, don't worry about that word, just for those of you who know about that stuff, I'll throw it in. T2 through 6 is where the nervous system innervation that regulates your breathing and your lymphatic tone to your lungs come from. So the place where we want to maybe do the most treatment is right in the middle, but actually to treat all the way from T1 through 12, which is also rib 1 through 12, on both sides is the goal. So what you want to do, and do this with your person sitting up first, because it'll be easier to feel, is locate that bony ridge, which is the middle of the spine. The spinous processes of the spine. So this very middle spot. Now, Andrali has really good back muscles, so they kind of drown out the ridge there. On a lot of us, you can actually see the ridge a little bit better, but you can feel it. And then the place where your fingers are going to be is you find that ridge and you come just off to the side in this kind of hunky muscle that runs up and down both sides of your spine, the paraspinal muscle. And you want to get just, ½ inch to the side of the spinous bony part. And you're going to place your fingers there, and then as much as you can, try and use the same amount of force between all 8 of your fingers, and you're going to just press and rock. So you're raising the head of those ribs that come in and attach to the spine in that spot. And we're just going to go up and down, and then you'll come to the other side with your patient laying down. Again, find that bony ridge and go up and down on this side. Okay, so let's try it. So let's have you lay on your back. Now, I know you guys don't have treatment tables at home, so you're doing this with a person on a couch or a bed. The firmer the surface, the better. It'll be hard for you mechanically to do this on the floor, because then you're going to have to hunch down and be like way under them. But if you can do it, you can do it on the floor. All right, so let me get your hair out from under you. Great. And so starting at the top of the spine, I'm going to treat the side of the spine that's closest to me. So I'm going to inch my fingers under here. You can ask your patient to lift up a little bit so you can get up under there. And again, with my fingertips, I'm finding that bony spinous process, which is the very middle of the vertebrae. And then moving my fingers towards me, just about ½ of an inch, lined up next to each other. And then using some pressure and using a very gentle, almost bouncing motion. And again, called rib raising. So now, if you look, he's going to show you what I'm doing with my fingers. Go ahead. Yeah, okay, good. So now, if you look at his chest, it's such a micro movement. but see if you can see it. Yeah, so that's about how much motion you want to get in there. And if you're not used to this, your fingers will get tired very fast, and that's okay. You want to do it in one spot for 20, maybe 30 seconds. And just get a little movement into the rib cage. Just stimulate the nerves that are entering at that area. And this can just help with getting more air into the lungs and just calming down that bronchospasm that happens with cough. So again, about 20 seconds on each spot. You do about 3 different spots to get up and down the whole thoracic spine. So I'm going to move down just a little bit here. Again, find my spinous processes, move over about ½ an inch towards me, line my fingers up, try and put about as much pressure across each finger, and take a deep breath yourself, and just very, very gentle bouncing motion. And if your patient's coughing, you can just take a break, let them finish, and start again. Make sure they're breathing though. Nice deep breaths. Okay, and then one more spot. I would say you probably have to shift all the way down. I'm gonna have you move this hand up just a little bit so that elbow's out of the way, and come to the bottom of that thoracic spine. And again, find your spot. Find the spine, move off to the side, line up your fingers, and very gentle bouncing. And so another really simple rib technique that use on kids all the time, because kids love to be rocked, but really, don't we all love to be rocked? Just like you were rocking a baby to sleep, just very gently putting your whole hand on the rib cage and just rocking. And doing that for even just a minute, it's a nice calming motion for your nervous system, and just gets all the circulation just sloshing around and getting to all those stuck places where we want it to clear out. And so then you would come around to the other side and do the other side of the spine again in 3 different spots. So that is very simple rib raising that you can do at home for a family member or friend who is on self-isolation with you. And it might help the cough clear a little bit faster. So thank you for joining me today. Again, I'm Dr. Noel